So diagnostic ultrasound is a really nice tool that I have in the office to help me visualize primarily soft tissues. So I can look for a variety of conditions with it. I use it very frequently to look for evidence of rotator cuff tears. I also use it to look for Achilles tendon ruptures or tendinitis. I can look at ligament injuries as well. And so it can be very helpful, particularly if I have someone in the office where I'd like to get a quick visualization of an area, especially if it's time critical and I'm concerned that it may take a little extra time to get an MRI. It does have limitations, just like any imaging modality does, but used in the correct way, it is a pretty powerful tool. So electrodiagnostic studies can be used to help diagnose a variety of conditions, such as carpal tunnel syndrome or a pinched nerve in the neck or the low back. They can also be used to diagnose a variety of neuropathies, and I also see patients who have had nerve-related trauma to help localize where the problem is. Physiatry is a little bit of a different specialty from orthopedic surgery, so we are non-surgeons is one of the big differences between us, but we can often work in close collaboration because there is a lot of overlap between the patients that we see. It's also helpful because it is often beneficial for an orthopedic surgeon to refer to a physiatrist or a physiatrist to refer to an orthopedic surgeon. I see people in a variety of stages in regards to injuries and pain. So I see people for acute injuries as soon as the day of the injury. I see people that have chronic injuries, and I do see some people longitudinally, particularly people who have arthritis or nagging old injuries where we're continuing to maintain their quality of life. Trigger point injections I'm typically performing for something called myofascial pain. So in some people there can be muscles, particularly commonly around the upper shoulder region or in the low back or hip region, that can become chronically tight, and there can be a pain spasm cycle that can be difficult to break. So trigger point injections are an injection where I'll inject some numbing medication and try to essentially kickstart that muscle to help it release that tension. Trigger point injections are typically done in the office as a routine in-office procedure. There isn't really any special preparation that needs to be done for them. It is relatively common to have a flare reaction, which can make things sore for a few days afterwards, although some people do get instant relief and they notice that there's a release of their tension immediately.